My name is Allie, and I work at Vista Park Animal Hospital. I'm also a student in the Open Learning Veterinary Technology program at Thompson Rivers University. Today I will be discussing anatomical planes in directional terms with my cat Lou. So the sagittal plane divides the body into left and right parts down the center line of the animal's body, dividing them into right and left, but it is not necessarily divided into equal halves. The median plane divides the body into equal right and left halves from the tip of their head down to their tail, but it is, and this is also equivalent to the term mid-sagittal plane. The transverse plane divides the body into equal parts. So from the cranial half is from the top of their head down to the center of their body, and then caudal is from the center of their body down to the tail end. The dorsal plane divides the body into dorsal and ventral parts. So this is from the midsection of their body up is dorsal, and then the mid-center down to the bottom is ventral. The right and left describes the animal's respective right and left sides, irrespective of the angles that they're being looked at. This is her right, this is her left. Cranial defines the upper half of the animal's body from their torso up to their head, and then caudal defines the lower parts of an animal's body from their torso region down to the tail. Rostral defines the direction from the tip towards the tip of the animal's nose. Caudal refers to the back portion of their head, and cranial defines their head in its entirety. Dorsal is used to describe the middle part of an animal towards the backbone, top surface of their body, and ventral describes the midsection down to the bottom half of their body towards their belly. Medial is closer to the median plane, or in other words, the center line of the body down this way here. Lateral refers to a location on the animal's body that is further away from the median plane, so for instance, this side of her body. The term deep or internal refers to a location that is closer to the middle of an animal's body. So for instance, if she were to have a puncture wound, the inner portion of where the puncture wound reaches would be considered deep, and then a scratch on her body would be considered a superficial or an external wound, so that refers to the outer part of an animal's body. Distal is the term that refers to the part of a limb which is further away from the rest of the body, so pointing down towards here near her paw, and proximal refers to the section of a limb which is closer to the rest of her body here. Palmar refers to the bottom portion of an animal's front paw, which is the equivalent of a human's palm, whereas plantar refers to the bottom surface of an animal's hind limb, which is equivalent to the sole of a human's foot. The flexion is to reduce the angle of a joint by flexing the limb, and extension is to increase the angle of the joint. Abduction is to move the limb away from the body, whereas adduction is to move the limb towards the body. Dorsal recumbency is when the animal is positioned on its back with its belly facing upwards. Sternal recumbency is when the animal is lying on their ventral surface or their belly with their back facing upwards. Lateral recumbency refers to an animal laying on its side, and then left and right is used to define which side of the animal that they are laying on. Oblique recumbency refers to when an animal's body is positioned with its body in between dorsal, lateral, or sternal recumbency, which can be used in radiographs in times when to prevent overlapping body structures in the imaging process. The stifle refers to the femoral, tibial, or femoral patellar joint, which is the equivalent to the human knee. The tail head refers to the dorsal part of the base of the tail, which is right here, and the pole refers to the top of the head between the base of the ears, right here. The barrel refers to the trunk of the body, which is formed by the rib cage and the abdomen. I apologize for my patient and her rambunctiousness. Thank you very much for your time.